Let's talk maybe a little bit about some of your prior experience with juvenile diabetes, as well as Pine Street, which is
Yeah.
the Pine Street Inn, which is a nonprofit focused on the homelessness. Thinking back on those two experiences, are there kind of specific lessons you learned, things that have been valuable for you now in your current role? Any reflections on those?
They're very different in a lot of ways, but there's a lot of commonalities because they both are trying to solve a problem. And with JDRF, you're trying to solve the how to cure type 1 diabetes, the whole autoimmune issue, and making sure that children who have type 1 have the tools and resources to live a healthy life until they get to the time when we really find a cure for that. When I was at Pine Street, the mission was to obviously solve homelessness. They are problem solving by investing in housing for individuals that have experienced homelessness, the unhoused people that we're really trying to make sure that they have low threshold housing so they're able to get into apartments and have the support they need, because once they get into a housing situation, their lives tend to stabilize. You can't imagine how unstable your life is if you're going to have a place to live. You can't get mail. You don't know what's going to happen one day the next. If once you get into an apartment and you have a stable living situation, you're able to do a lot more to really improve their life as far as having regular doctor's appointments so their health gets better, be able to possibly find employment. So there's a variety of tools. I think that both were trying to solve problems and really focused on those things that are matter to the donors.